You have to listen to this.
I think it's time for people to start questioning. Start questioning the health professionals. It's time for you health professionals to realise you're doing more harm than good. I could have taken my own life because yous made me believe this was in my head. This narrative will change in the near future. Trust me when I say it. I want this message to get around the whole world and make yous realise it's time to start doing the right thing. You're killing people and making people think they're gone crazy.
This touched me. He is reflecting a feeling that is growing across the world, and it needs to be addressed. And so I'm going to try and give some clinical context to what he is talking about. What really is it that is causing patients to feel so upset with regards to vaccine-related complications? The medical and health industry needs to find some answers, and we need to be honest, and we need to be clear. So what I'm going to do is take you through most of what he said and try and give a clinical side to what exactly he's putting forward.
And a quick update in regarding my PET scan that I got last week. I got the results at the start of the week, and it turns out myocarditis.
I'll just pause you here because what he's saying is he got a PET scan, so a positron emission tomography, and that was looking at his heart, which confirmed that he had myocarditis. Okay, so the PET scan is the important thing. It's quite a sophisticated test and certainly not something that most clinicians have access to. It's usually in a tertiary center or for quite significant reasons. So let's continue with what he's saying.
Myocarditis. It's taken over a year to diagnose me, and a specialist in the UK, specialist cardiologist in the UK, to tell me that it's myocarditis from the vaccine.
Again, I will pause you here. So, in effect, what he's saying, it's taken him about a year to get a formal diagnosis of myocarditis related to the vaccine. Now, we can presume he's talking about the COVID vaccine, as this has been associated with myocarditis. Important to note that as yet I've not heard anybody explain clearly why the COVID-19 vaccine is associated with myocarditis. We know that it's clearly an association. It was first deemed to be misinformation, but then the evidence became stronger, and so it was accepted that it occurred. But now the view is that it happens only in a small number of people. Now, we have to be careful here from a clinical perspective because we need to make sure that that is actually so. So let's continue listening to what he has to say.
I've seen over about 5 different cardiologists in Scotland. Not one of them, as soon as I say this is from the vaccine, not one of them want to acknowledge me.
This is another important point. People don't want to acknowledge potential vaccine-related issues. Now, I think that it may be difficult, and I'll try and be balanced here, because clearly he perceived that the vaccine was the cause of his issues. And so his first reference point when he was probably speaking to clinicians was that this is a vaccine-induced injury. For clinicians who have completely bought into the fact that this is extremely rare and therefore it's unlikely, they could easily discount what he's saying. And this seems to be what was getting him upset. And I can only caution people is that it's important, even if you think that the condition you're dealing with is because of something, your role when you go to the clinician or to the doctor is to put across objective information. Let them come to that conclusion. And it's oftentimes in situations where that information is forced onto the clinician that they sometimes reject it from the patient. I'm not saying that's right, but I'm being practical and being honest about what some of the issues can be as a clinician dealing with a patient. So let's hear what else he had to say.
Well, there you have it. Myocarditis 1 year later after the vaccine. been complaining about chest pain, complaining about heart issues. And what was I told? It's anxiety, PTSD, health anxiety, all in my head.
Again, I'll pause you here. Listen, you can see that the patient is upset. And the reality is that for a number of conditions, especially what we consider to be functionally related conditions, or conditions where symptoms are psychosomatic, meaning that the patient is having real symptoms or perceived symptoms, but they are not directly related to any organic pathology. The difficulty from a clinical point of view is if you have done the appropriate investigations and you haven't found any clear abnormalities, and a patient is still having symptoms, it is part of the remit to consider whether or not it's mind over matter. And I suspect that, again, in this context, because he was talking about vaccine-related injuries, in a context where many clinicians don't accept that the vaccines can cause harm, very easily they could discount his symptoms as psychosomatic, just in his head, anxiety, post-traumatic stress disorder. And again, this is not a justification. It's just an opportunity for me to share what can easily happen from a clinical point of view. So let's continue to listen.
But now I've got confirmation that it wasn't. This is a message to all the health professionals.
And this is what he said at the beginning, and we'll listen to it again at the end. The message to the health professionals. So here are the sequence of investigations that he probably had, seeing a number of specialists in his home country. He would have probably had an ECG. That's a baseline investigation. He would have probably had routine blood tests, specifically looking at markers of heart damage that were essentially normal. He could have then gone on to have an echocardiogram. And the echocardiogram may have been slightly abnormal, but if you don't know what his baseline function was, it could easily be discounted as being just normal. Additionally, he may have had a cardiac MRI, and that studies in more detail the function of the heart. What he seemed to have that diagnosed the myocarditis, the inflammation of the heart muscle, was a positron emission tomography scan, which clearly showed inflammation in the heart. In the recent autopsy series, or actually not autopsy, endomyocardial biopsy series that I recently pointed out, the diagnosis was made by taking a small amount of tissue from the heart. But this again is a very specialist investigation and one that you would do as a last resort. So in a sense, if a diagnosis can be made with a PET scan, even though it is expensive and limited in access, that would be probably safer than an endomyocardial biopsy. Here is the reality. Myocarditis has never been properly studied in the context of COVID-19 and vaccinations. Why do I say that? The closest we have had is in Thailand, where they looked at children, 312 children, and they did the ECG, the blood tests, they did the echocardiogram. That was the limit to what they did. And even in that cohort with children, 1 in 43 had some kind of cardiac abnormality after having the vaccination. What we should have done, and what remains to be proven or done, is what we did in the Big 10 study, where we took, when we were looking for myocarditis in COVID-19 in university students, they had an echocardiogram as well as a cardiac MRI to look for evidence of myocarditis from the infection, which they found. That was not replicated in the context of the vaccine. That is where the responsibility will come back to haunt us. We needed to make sure, and we needed to find out that when patients are having ongoing symptoms that could be related to vaccination, there was a responsibility from the healthcare industry to do as much as we could to clarify it. That's the lesson that I take away from this. And this is his anger at the moment. And our problem is that there will be many more people like him, similar experiences, they are passed off as nothing simply because the initial investigations didn't show an abnormality and the healthcare infrastructure doesn't actually believe that myocarditis is a relatively or a more common complication of vaccines because we didn't do the appropriate research. Remember, the absence of evidence is only relevant if we did the studies. So that's the bit that concerns me, and that's the bit that I think should concern everyone. We have the responsibility to do better with the research that's in front of us. So let's remind ourselves what he is so angry about.
I'm going to start calling you the health unprofessionals. If I had sat here and it just accepted what you told me, I would never have got an answer and never understood what was going on with my heart here. I want people to realise it took me a year and it's taken me £27,000 to get an answer for my heart. I want people to realise if you're going to your doctor and your doctor's telling you this is in your head, this is anxiety or whatnot, you know your body better than these. You know yourself better than this. This vaccine is doing more harm than good. 1 year they have left me with myocarditis. I think it's time for people to start questioning. People start questioning the health professionals. It's time for you health professionals to realise you're doing more harm than good. I could have taken my own life because you made me believe this was in my head. This narrative will change in the near future. Trust me when I say it. I want this message to get around the whole world and make you realise it's time to start doing the right thing. You're killing people and making people think they're gone crazy.
Wow. I felt that. And I think every healthcare person who looks at the patients who are suffering from vaccine injuries should feel that as well. Something for us all to think about. Thank you.